Welcome to Lifestyle with Dr. Moby. I'm Dr. Moby, and today we are honored with a great guest. Dr. Mack is with us. Let's welcome Dr. Mack. How are you doing?
I'm doing wonderful. How are you, Dr. Moby?
Good, thank you. And so tell us about yourself.
So I am a sports chiropractor. I'm located in the Twin Cities here in Minnesota,
Mhm,
and I primarily run a sports based practice, but
mhm.
I do treat pretty much everyone. And I've partnered with a couple teams to keep things interesting, such as Minnesota Roller Derby, a professional women's football team, the Minnesota Pride,
Mhm.
and a drum corps international marching band, the River City Rhythms. So I kind of run around and do as much as possible to keep things fun and interesting.
Very nice, very nice. Minnesota is my favorite. I actually lived also in Midwest area, Upper Michigan. I'm sure you know about, right?
I'm actually originally from Michigan in the northern part of the lower peninsula, so I might actually know where you're from.
Okay, well, I was in Escanaba area, so very
Oh, way up there in the upper peninsula. Absolutely.
so, and I diehard fan of Vikings. I used to follow Mall of America. Of course, came many times there. It was a great drive from there. So it's and Minnesota full of lakes, fishing.
Yep, we have all of those wonderful activities. Granted, this year has been a bit rough, I think, for everyone, but in particular, we have had the snowiest October on
Oh,
record. We already have 8.5 inches of snow.
wow. Well, I mean, it doesn't surprise me because, in Marquette, Michigan, we used to measure snow in feet. So in Escanaba, we used to measure in inches. So that was the difference.
Always living on Lake Superior is rough. When I went to school in Sault Ste. Marie, Michigan, which is 2.5 hours east of Marquette,
I know that.
we got saturated with snow there.
Mm. But beautiful, beautiful area. Lake Superior, all those are so pretty. I think Sault Ste. Marie, all that area. I think if anybody didn't go, they should really go.
Oh, it's an incredible location.
Mm. I mean, it's cold, but it's very, very pretty. So tell us about your work. You mentioned about that you do sports Cairo, right?
Mhm.
So tell us a little bit about that. What is the scope normally you take care of those?
Absolutely. So, generally, when a chiropractor graduates with their Doctor of Chiropractic, they enter the workforce as a general chiropractor. I opted to take 2 years and do specialty training at the university under a veteran sports provider and then travel around the country and travel some internationally treating different high level athletes. And then I sat an exam to get my certification in both national sports chiropractic. So it's called my CCSP, Certified Chiropractic Sports Practitioner. And then I also have my ICSC, which is the internationally certified sports chiropractor. And those two things really help me zone in and work on athletes at the highest level possible. And those are typically our Olympic athletes. But then it also allows me to take that and work with just a population that wants to be active. So I typically refer to my patients as athletes, whether they're actually going to be going out on the field and trying to hit each other, such as football, or just wanting to go in the backyard and play catch with their kids. Whatever their sport is the activity that I work with them on. Now, within chiropractic, there are many different specialties, and it's not required to have it, but I wanted to make sure that when I was treating, I had the highest level of evidence and science behind me. Plus, I am forced to keep up with extra continuing ed hours to keep those certifications, which helps me be the best provider possible for my patients.
So I said, do you deal with only the certain sports or all kind of sports in your?
All kind of sports. So predominantly, I would say my current population are American football players, roller derby athletes, high performance marching band athletes, and hockey players, CrossFit athletes, and what we would call our more performance when it comes to work. So firefighters, EMS, and police. So
Mhm.
our tactical athletes, those are kind of the ones that I currently am working with the most, but I've worked with everything from rugby, Australian rules football, soccer, basketball, volleyball. Kind of, if it exists, I've probably worked on it at some point, except for some of the really obscure sports in America, such as korfball or Paso Paulo, like those really internationally specific, I haven't worked with, but otherwise, I try to keep my sports palette very diverse because it's fun. It's new injuries, it's different aspects, and it keeps me on my toes.
Yeah, so that is very broad spectrum. So tell me a little bit about some of the common injuries we see. So we'll talk those, and then we talk about prevention of those.
Oh, absolutely. I would say the thing that I've seen the most
Mhm.
because of working with a female team is ACL ruptures. Uh, with adding contact with American football, it's just going to happen. And with some confounding factors with being a female athlete, I've seen close to 16 ACLs from contact versus non contact, and then shoulder injuries. Those are probably the two things that repeatedly come into my office from a contact sport. For my more general everyday person, I'm dealing with a lot more neck and low back pain right now. And I think that's just from everyone working from home and not having their perfect ergonomic setup with their desk and having to do modifications because they are at home. So those are kind of the things that I've been consistently seeing: knees, shoulders, low backs, and necks.
So, do you think certain sports are, of course, more prone than the others? Um, so, do you have other sports like more worse than in certain ACL injury? Of course, running ones, or where there's a lot of rotation or moving.
So, pretty much any sport that has a cutting activity, so a quick change of direction, puts extra stress on the body and can cause further injury. So, football, soccer, basketball are kind of the three big ones when I'm thinking of ACL and knee injuries. When you're looking at the research, especially within the collegiate sport realm, the NCAA here in America has put out studies, and ACL in female soccer players is the most common
Mhm.
place to have that injury. Granted, when it comes to knees, there's one sport where the risk of ACL injury is equal for the sexes, and that's downhill skiing. So whether you're male or female and downhill skiing, that's when you have the same risk for tearing an ACL. So it really just depends upon the activity, the amount of running, the amount of cutting, and really when looking at the research of where the risks are, it depends upon the popularity of the sport, whether money has been invested in determining is there a worthwhile injury risk prevention. So you kind of have to extrapolate out from what is available in the research. And soccer, honestly, soccer or football overseas has done a phenomenal job of researching ACL and hamstring
Mhm.
injuries, particularly because of how common they are with the amount of running and changing direction.
Hmm. So, let's talk a little bit about, I know football, you said you deal with those, and those are very, very common. So, I mean, we have other injuries, but, all kind of injuries, but mostly you deal with is musculoskeletal or,
Mhm.
the ACLs and shoulders, probably. So, let's talk one by one. What things, the, younger athlete could do for ACL, and then we talk also on shoulder a little bit.
Yeah. So, one thing, ACL prevention, it's all about loading and testing the joint in the sport that they're going to be doing. So, when it comes to soccer, and they've done the most research on it, what they found is that when you can implement a injury prevention program into the warm up
Hmm.
of the sport for that athlete, that's going to give you the best efficacy for doing it, and to therefore give you the best probable injury prevention. Now, things that I've done with my athletes personally is one, we have to load the joint. So ligaments and tendons respond really well to stress and high volume. So isometrics and heavy weighted squats
Hmm.
under a supervised strength and conditioning coach are really important for those athletes to make sure that they're using the appropriate form and getting the correct loading for the activity. And then also doing plyometrics and explosive activities where they're
Hmm.
powering through, they're jumping, they're landing, they're going through the movements that they're going to have to utilize and going through different changes of direction. That combination of load with weight and power with movement kind of give the best prevention possible. Granted, I can't guarantee anything because there's going to be those freak accidents. There's going to be those times they step in a hole or they get hit by another player and things just happen. Because if there was a perfect prevention program, I guarantee the professional athletes that are being paid thousands, hundreds of thousands, millions of dollars
Hmm.
would be utilizing it and not getting injured. And we can all see, especially this year in the NFL, there have been a number of season ending injuries that more so than I really have remembered in past years, which makes me wonder if the fact that this preseason, we didn't have as much contact with preseason games, we didn't have as much regular practice due to the pandemic going on, if that didn't contribute to the number of injuries we're seeing that are causing long term effects for the athletes competing at that level.
Yeah, so you're absolutely right. There's no magic bullet for these injuries, and if there was, all these sports, they would be really looking for that. So best, and that is sad. Certain, with NFL, we have seen, the quarterbacks doing so well, and all of a sudden they had ACL on end of season. Right? You're just like boom, right? So these are. Do you think with COVID, because we might have cut short preseason as well as those practice sessions, did is going to cause more problem because the muscles or the body is not as strained?
I think the biggest thing that we're seeing is that the athletes aren't used to being hit. I mean, yes, especially in the NFL, they've been playing for many, many years. They have been hit many, many times. But when you have those months off and then going back into it, your body has to adjust. It's all about adaptation. And when we don't apply the appropriate stresses that our body needs to adapt to scaled,
Hmm.
that's when we start to see significant injuries start to compound. So they didn't have their traditional preseason with preseason games. They didn't have their usual practice sessions because of the limitations of COVID and wanting to reduce exposure, which is absolutely what we should be doing right now. But now we're in season and we're definitely seeing some of those consequences. And even with my high school athletes,
Mhm.
high school football in Minnesota had been canceled and moved to the spring
Mhm.
up until about the beginning of October. And then all of a sudden they went, we've decided we are going to hold football. And then all the players were scrambling to get in shape, get ready. And the coaches were scrambling to get plays in place. And I don't necessarily know if the players, even at the lower levels, had time to get the contact in to have their body appropriately adapt to the new stimulus and thus be able to not have as much injury. So it's one of those things that I think it'll be interesting to read the research coming out in a year to 6 months to see if there was a pattern of reduced preseason time and increased in season injuries.
Yeah, that would be, I'm interested in looking at that, because is it, then, but there's another, of course, notion is injury prevention techniques, and those, are, of course, always there. And then if the injury happens, then recognizing it and taking appropriate care. So those are, of course, all part of that. A lot of the times we have seen that, athletes might be injured, but they, for the sake of game or all the adrenaline rush, they don't want to be put out, or they might fake or pretend they are okay. Is that a big problem, do you see?
So, this is where having the right sideline provider is important, and knowing your team and knowing your players is important. And uh, as a sports chiro, I both work with the athletes in office, and then I do work with them on the sideline. And I got my EMT to make sure that I had the appropriate emergency training to respond to anything that could occur. So I have that dual licensing. And the biggest thing I found is when I'm with a team that I don't know, the athletes are less likely to come talk to me. They're less likely to reveal they're having a problem, and they're more likely to hide it. The closer I know the athletes, the better relationship, the better trust I have with them. They know I won't pull them unless I honestly believe they're going to do further damage. And having that trust is an important matrix, which is why most high schools have athletic trainers on campus working with the athletes both at games and during practices, and allowing them to have access to that care, which is a dream that just wasn't something that was available when I was a kid being an athlete. And now that I'm on the other side and I'm being that provider, I like to work with my teams. I like to know them. I like to be able to see them if they get hit and know, oh, you're acting emotionally different than what I would anticipate you behaving in this scenario, which can be one of the symptoms for one of the scarier conditions that we deal with, concussion. When you have that emotional changes, when you have that emotional instability, that can be one of the symptoms that most early presents and can help you pull an athlete and make sure that they get off the field appropriately. And if you don't know your team and you don't know your players, that's a hard call to make when you're going, are you just being emotional because you're losing? Are you being emotional because your head ate turf 10 minutes ago? So it's one of those things that, for the most part, my athletes, because I spend the time working with them during the preseason, I go to their practices, I do their cool downs, I do their injury prevention. They know me, they trust me. I've never had issues. They fought me. They've thrown temper tantrums on me. I've had to take gear from them. I'm known for taking helmets, mouth guards, cleats. I've cut shoelaces. Whatever I have to do to keep the athlete out, I'll do. Probably the biggest problem I've dealt with is not so much the athletes. They get it. They understand why they're being pulled. It's when I'm working with underage athletes and I have to deal with the parents.
Oh,
parents of the children are the hardest ones to have them understand, hey, I pulled your kid not because I don't want them to go to college on a scholarship. It's because I want them to go to college on a scholarship, and probably an academic scholarship. I don't want them to have any permanent disability. And conveying that message has always been one of the more challenging pieces, because parents are so engaged in making sure their kids get the court time, get the field time, have the best accessibility for off-season activities, and are doing the best to set their kids up to do well in their sport. And sometimes they can have some well intentions that just aren't going to be best for that athlete at the time.
And those are so true that, we have seen that, the parents sometimes push them, or they are just afraid to disappoint their parents or something. So there's a lot of peer pressure and parents pressure, whatever you call it. And then that's gonna really can lead to more injuries. With the most injuries, you can get, if you're determined about that you're gonna be really good at it in later time, you can really do rehab and work with doctor, and you can really come to a better solution rather than pushing and damaging your body forever, because there's a life after that, after that career. And then we want you to be successful after that, not just be really crippled because of the injuries, right?
Yeah, and that brings up one topic that is probably one of the most challenging things to explain to parents, and that your kid needs to be a multi-sport athlete. They don't need to sport specialize. One, when you sport specialize at a young age, so let's say you're taking your 8, 9-year-old kid and they are going to be the next future Raypon for the US
Mhm.
soccer team. Like they're soccering all year round, maybe only having 4 or 5 weeks off a year. One, that repetitiveness of that sport is going to cause overuse injuries. It's going to cause pain. It's going to cause long-term problems.
Mhm.
The other thing I've seen with those sports specialized athletes so young is by the time they're reaching the ages that they need to be specialized, they hate the sport. They've been injured so many times, they don't want to play and they give up on it. So, this is how I kind of look at it. One, let your kid be a kid. Play as many sports as they want until high school. Let their body mature. Let their body go through puberty. Allow them to develop muscular balance. Have them be well rounded. Then, as they're getting into their sophomore, junior year, when they're starting to attract college attention, that's when you start specializing. That last 3 to 4 years before graduation, that's a great opportunity to specialize if your kid actually wants to. That way, they have less injury risk. They have the best opportunities to be seen by scouts, and they're not burned out on their sport to the point that they hate it.
Yeah, yeah, that is true. That is so true. So thank you for coming. It was such an informative talk for a lot of my viewers. So any final thoughts you have for my audience?
I think the biggest thing I can say is for anybody listening to this, I know we talked a lot about athletes and injury prevention. Just recognize the fact that everyone in their own life is an athlete of some sort, whether that's going out for a walk, simply going for a bike ride, or maybe just simply getting up for the day to cook. Whatever your sport is, make sure that you're doing the best you can to stay active, stay healthy, stay hydrated, and eat well. That way you can live the longest, most active life possible.
And that is so true. And with that message, I again emphasize, make sure, take care of your body, because, and let it heal. It has a lot of power to come back and do amazing thing, but we have to stay positive and keep working with the body. Don't test the limits, because that's gonna really harm it long term. But you definitely have a life to live, and take care, sleep better, eat better, and stay happy and healthy. Take care and thank you. Give us feedback. We'll be very happy to put that in. And thank you, Dr. Mack. It was wonderful talking to you. Take care. Thank you.
Thank you, Dr. Moby.
Thank you. Thank you.